Good morning, students. Happily enough, we are on the last session of our course, NURS 336 Occupational and Community Health Services. We are still looking at care of the elderly, but with focus on prevention of home accidents and palliative care. The new word here is palliative care. We'll soon see what it means. Students, home accidents happen predominantly in children, adolescents, and the elderly. Even though a school of thought contends that it is a myth to consider the elderly as accident-prone, accidents do happen amongst them, and there is need for prevention. The elderly may be particularly susceptible to accidents, probably due to poor vision, arthritis with impaired mobility, sensory impairments, among others. Prevention of home accidents, therefore, is one core area where community health nurses focus their health education. Educating family members about risks and hazards that are likely to bring about home accidents would help to prevent them and protect elderly persons from unnecessary harm in their own homes. Health promotion principles hold that people's homes should be safe, stimulating, and enjoyable. Palliative care, an interdisciplinary team-based care for persons and family members experiencing life-threatening illness or injury that addresses their physical, emotional, social, and spiritual needs, is introduced. At the end of this session, students, you should be able to describe the types of home accidents or accidents that can occur in the home. You should also be able to identify the common hazards in homes and describe the causes of home accidents. Finally, students, you need to be able to discuss how the elderly can be protected from accidents that occur in their own homes. We are looking at care of the elderly with focus on prevention of home accidents. These are your reading lists or references. Do well to contact the references and make sure you read them. We are looking at the types of home accidents, and I have a question to ask. What types of home accidents do you think the elderly are prone to? What are the types of accidents the elderly are prone to? And I have put there 2, falls and burns. You may add to the list. The falls could come with fractures or without fractures. Do well to add to my list of 2. What are hazards? I'm sure in our earlier sessions we have described hazards, but we are now looking at hazards in the home. What are the hazardous situations in the home that can lead to accidents? And I have listed a few. They include loose electrical wires in the living rooms. When you all go back to your homes, just look at your homes, look at your sitting rooms and the network of electrical wires there. These could easily lead to home accidents, especially in very young children and the elderly. Do you agree? They may not see, and these wires may hook their legs or trap their feet, and then they fall and may or may not get fractures. Another hazard is spilling water. These days, most homes have tiles. Imagine you have spilled water on the tile and an elderly person is walking in that area. He or she may easily have a fall and break a bone. Is that not true? So spillage of water is another hazard. And then obstacles in people's pathway. Sometimes the way we arrange things in our homes, even those who have eyes cannot meander through our arrangements. We have loaded our rooms, sitting rooms, with many gadgets. Loudspeaker here, table there, chair here, so many things. And it is so difficult for young children and the elderly to find their way among these things we have arranged in both our bedrooms and in our sitting rooms. And they are obstacles in the way of the elderly and can cause them to fall. We also have problems with dark rooms. Some of the rooms may have light, but the light may not be bright enough. The lighting is poor. And with poor visibility, the elderly can hit their heads against something, or they may even hurt themselves in one way or the other. So dark rooms with poor lighting also cause problems in the home and may lead to accidents. Leaving poisonous materials within easy reach. On most medicine packages, it is said that keep out of reach of children. But we have to keep out of reach of the elderly too. Sometimes they get confused and may swallow certain tablets, even not belonging to them. I know of an elderly man who chewed naphthalene balls, or what we call camphor. He just chewed them. And nobody saw him chewing them. I don't know, he was even blind, and how he found the naphthalene balls, nobody knows. And then he started passing very dark urine, like tea or Coca-Cola, and he was admitted at the emergency unit of the hospital. This was an 80-year-old man who had enough teeth to chew naphthalene balls or camphor, and that was dangerous. Poor storage of sharps and dangerous tools can also make the elderly people hurt themselves. Nobody knows what an elderly person may want to do with a hammer or a knife, and he or she may hurt himself or herself. What are the causes of home accidents? Poor arrangements of household works with less room for free movement, poor lighting, as I have explained earlier, exposed and faulty electrical wires and gadgets. Now, how do we prevent the elderly from home accidents? So looking back at what we mentioned as hazards, we have to avoid certain things. We have to avoid spillage of liquid on floors. If it should occur, wipe them immediately and make sure the elderly do not walk on slippery grounds. We also have to ensure that dangerous tools are kept away from their reach. The elderly need to be monitored. They should be monitored by family caregivers or whoever looks after them. You have to keep an eye on them. I do not want to say that we have to keep an eye on them like children. They may not like to hear that, but at least I'm telling you quietly that keep an eye on the elderly so they don't get hurt. The elderly should be supervised to take their medications. Sometimes they forget. They take a medication and they've forgotten they've taken it and they take it again, and this can be dangerous. So supervise the elderly to take their medications. We have said that the elderly people have multiple health problems, some of them. So they may have many medications to take. And forgetfulness is a problem. Amnesia is a problem. So we have to monitor them or supervise them to take their drugs. We should make sure that our bathrooms are not slippery, because if they are slippery, they will fall. So bathrooms should be cleaned regularly and should not be slippery. And we should make sure the bathrooms where they have their baths are not hazardous. Imagine making or telling a 75-year-old woman who is not strong enough or a little frail to climb up a bathtub and have a bath. She may even sleep. Usually people of that age like sitting down when bathing. So it is best not for them to bath in bathtubs, but rather to bath on floors with washed terrazzo that are rough so they don't fall. And then you place a seat, a chair, or a stool in the bathroom and help the elderly to take their bath if they need the help. Demented elderly persons should be monitored closely. so they don't harm themselves. Sometimes, if you don't keep an eye on them, they may even go out of the house. There's a sad story of a demented elderly man who got lost from his home in a suburb of Accra. His family looked for him and never found him. And the last resort was to go from mortuary to mortuary looking for him. Eventually, they found him in one of the mortuaries, having been knocked down by a car and dead. And nobody knows when, nobody knows how. At least they know he was knocked down by a vehicle. What a sad story. So demented elderly persons should be monitored closely. Hot objects or food that is hot and liquids should be kept out of their reach. Putting poisons away from easy reach is also essential. Keeping medications in safe place is a good thing to do. Assist very frail elderly persons with self-care. There are things they cannot do for themselves. Some of them cannot even brush their teeth. They can't comb their hair. They can't wash their hair. They can't clean their feet when bathing. It is up to family caregivers to help them to maintain personal and environmental hygiene. So it is our responsibility as family members or nurses, where we need to educate the family members to tell them to assist frail elderly persons with self-care and activities of daily living. Now, the new word, palliative care. Palliative care is interdisciplinary team care focused on the relief or suffering for clients with serious illness. You want to relieve suffering of clients with serious illness. Palliative care seeks to attain the best quality of life for clients and their families. Palliative care encompasses nursing intervention that help to enhance clients' quality of life, reduce pain and suffering, and ensure the highest level of functioning. Once again, we need to know or bear in mind that palliative care is most suitable for clients with life-limiting serious illnesses. Palliative care is most appropriate for elderly persons with the following: acute, serious, life-threatening illness such as cancer, stroke, or myocardial infarction. Palliative care is also appropriate for elderly persons with progressive chronic illnesses such as dementia, congestive cardiac failure, renal or liver failure. Dear students, still on palliative care, this type of care or this special care can be rendered in all settings. In settings such as hospitals, outpatient clinics, the home, and palliative care focuses on controlling symptoms, coordinating care, reducing unnecessary tests and interventions, and ongoing conversation with clients and their families. In palliative care, both the client and family members are supported during the dying and bereavement periods. It is not an easy thing to have a family member who is dying and just lying in front of you. What do? If you are not careful, you, the family member, will even break down before the person dies. This is where nurses, community health nurses, or nurses in adult health need to give both the client and family members the form of support they need. Palliative care ensures that quality of life is enhanced and life is lived to the fullest until death. Palliative care is highly essential. In summary, I must say that home accidents, though preventable, can occur and affect the elderly. Family caregivers should ensure that hazards and risks for home accidents are reduced to the barest minimum. Falls, burns, cuts, and bruises are examples of home accidents to be prevented in the elderly. Palliative care emphasizes quality care and living the fullest possible life until death. Thank you.